Hello, welcome to the Pearl River Community College Physical Therapist Assistant Program Information Session. This is conducted to help you understand the application process and some aspects of our program before you apply to the program. It's also a requirement to watch this presentation or to attend an in-person session. I'm Tracy Thornton. I'm the program director. LaBrisca Sylvester is our clinical director, and Audrey Rogers is an instructor in our program. So when you're talking about being interested in physical therapy as a profession, PTs and PTAs are considered the movement experts in healthcare. So PTs and PTAs are the healthcare professionals who are diagnosing and treating patients of all ages with various medical problems or other health-related conditions that are limiting their ability to move and to be functional in their daily lives. The role of the physical therapist and also the physical therapist assistant in healthcare is to be able to diagnose and manage those movement dysfunctions and to enhance physical and functional abilities. We also look to restore, maintain, and promote that optimal physical function, wellness and fitness, and quality of life as it relates to movement and health. We're also instrumental in preventing the onset, symptoms, and progression of different types of health impairments, functional limitations, and activity limitations that may result from diseases, disorders, conditions, or injuries. So where do physical therapist assistants work? We work in a big variety of facilities and practice settings, including acute care hospital settings, extended care facilities or nursing homes, home health, hospice, industrial and workplace environments, local, state, and federal governments, outpatient clinics, rehabilitation centers, research centers, school-based therapy, as well as wellness prevention, sports, and fitness centers. We also are very instrumental in travel contracts that are available all over the nation. Some examples of conditions treated in physical therapy are everything from arthritis to back pain to all other types of pain, balance and coordination issues, burns and other wounds, carpal tunnel syndrome and other work-related injuries, developmental delays in pediatrics, chronic obstructive pulmonary disease and other respiratory conditions, cardiac rehab, dislocations and fractures, hand injuries, headaches, incontinence, lymphedema, osteoporosis, pelvic pain, spinal cord injuries, sports injuries, stroke, and traumatic brain injury, in addition to many other conditions that are treated by physical therapy. So some of the biggest things that are important to a profession are the core values, and it's very critical that PTs and PTAs follow these elements of professionalism, including accountability, altruism, compassion and caring, excellence, integrity, professional duty, and social responsibility. Physical therapy is a profession that has a very high job satisfaction. So we have several references that show that physical therapists and physical therapist assistants have grades of A for personal job satisfaction, quality of life indicators, what are the 10 happiest jobs in 2023, and also 78% were very satisfied with their chosen career. So it's something that we enjoy as a profession and that we think that you will enjoy as well. As far as the job outlook for the physical therapist assistant, according to the U.S. Bureau of Labor Statistics in 2024, PTA employment is expected to continue to grow by 39% through 2033. Current employment is expected to go from 238,000 to 356,000 jobs by 2031. It is also rated as the best jobs in America and one of the fastest growing jobs, with the highest growth expected in rural areas and geriatrics as well as pediatrics. The benefits of a physical therapist assistant career include making a difference in patients' lives and being able to be a change maker for them, helping them to become more functional as you help improve their quality of life, being that movement expert that the public looks to for help and support, enjoying really good job security in your profession, loving what you're doing by helping others, being able to choose your location and practice setting where you work, and also being an entrepreneur to be able to manage or even own your own clinic. Some people want to know the key differences between occupational therapy and physical therapy because we have a lot of things that overlap. So in physical therapy, we are really looking at more movement restrictions from illnesses and injury, and we're learning to use exercises and techniques to help with pain management and to increase mobility and muscle strength. We also help develop fitness and wellness programs at injury prevention and encourage a more active lifestyle. So we want to work on functional ability by helping patients regain mobility skills, as well as making recommendations about adaptive equipment like wheelchairs and walkers. We also are able to use specific techniques such as massage, stretching, ultrasound, electrotherapy, and hydrotherapy to help keep patients on the road to recovery. In contrast, occupational therapy, they tend to help patients more with those daily living skills and self-care tasks such as getting dressed or eating. They support patients with memory loss, cognitive issues. They also help with adaptive equipment and assistive technology devices. They help with accessibility needs. They work on handwriting and scissors and school-type therapy. And they work on behavior modification plans for patients that struggle with behavior issues as well. So those are some of the differences between the job duties between the two professions. As far as physical therapy education goes, to get a PT or PTA degree to practice as a physical therapist in the United States, you must first earn a doctorate of physical therapy degree from a program accredited by the Commission on Accreditation in Physical Therapy Education, which is CAPTE, and pass a national licensure exam. To practice as a physical therapist assistant, which our program educates you towards, you must earn an AAS degree in physical therapist assisted technology from a program accredited by CAPTE and also pass a national licensure exam. When we look at educational time periods, the length of a PT program is typically 3 years following a 3 to 4 year degree plan in a bachelor's degree, whereas the length of the PTA program is typically about 2 years or less. Both groups have time in the classroom and lab, about 80% of the program, with 20% of the time spent on those terminal clinical experiences in order to learn on-the-job experiences with a clinical instructor out in the practice settings. Primary content areas that we teach in the curriculum include biology, anatomy and physiology, physiology, exercise physiology, biomechanics, kinesiology, neuroscience, pharmacology, learning about different medications and their side effects, the pathology of all the different diagnostic conditions along with their clinical manifestations, behavioral sciences such as psychology, communication skills, usually through a speech class, ethics and values, management sciences, learning about finance and reimbursement, sociology, clinical reasoning, evidence-based practice based on research, cardiovascular and pulmonary conditions, endocrine and metabolic conditions, as well as those musculoskeletal conditions. So the physical demands of a PTA job is usually going to have a medium work defined by the U.S. Department of Labor. So frequently 20 pounds of lifting with infrequent lifting of 50 pounds and over, sometimes higher, with an energy requirement at about 3.5 to 5 METs, which is considered moderate to high level of energy requirement. The typical physical job demands of a physical therapist assistant: prolonged walking, prolonged sitting, pushing equipment, wheelchairs, bending, squatting, assisting the patient with exercises, and being able to transfer patients in excess of 100 pounds and more. As part of our curriculum here at PRCC's PTA program, students are asked to perform various physical activities that include transferring patients, lifting, carrying, pushing, pulling heavy objects, prolonged sitting and standing, walking, squatting, reaching, handling, manipulating small objects, cardiovascular workouts on therapeutic equipment, and isotonic, isokinetic, or isometric exercise programs. Student experiences are going to also include exposure to various forms of mechanical, radiant, thermal, acoustic, and electrical energy, and potential exposure to chemicals used in the preservation of biological tissues or for cleaning equipment such as the whirlpool. Student experiences also include very close physical contact and touch with other students, faculty, and patients during those clinical rotations, and also laboratory experiences. These will all occur under the supervision of academic and clinical instructors in order to promote learning of these physical therapy skills. You also must have good skills of observation, so accurate visual, auditory, and tactile observation of patients, observation of instruments, therapeutic devices, measuring devices, tactile observation, and being able to interpret lab and lecture materials, handouts, books, and all electronic information. You must also have really good communication skills, appropriate and effective written, oral, and nonverbal communication while maintaining sensitivity to individual, cultural, and economic differences, appropriate and effective electronic communication via computer, and interpretation of scientific terms into lay terms. You also need to have excellent resource, time, and stress management with effective management of your personal resources, time, and stress in order to allow you to have dedication to full-time or part-time academic course load and a full patient caseload in directed practice in your clinical experiences. You must have professional, ethical, and good conduct. So your personal conduct, your professional dress and hygiene must be professional, safe, ethical, and legal in accordance with the American Physical Therapy Association standards of ethical conduct for the physical therapist assistant and value-based behaviors for the physical therapist assistant. Cognitive function is very important, so you must be able to problem solve in a timely manner, be able to perform critical analysis, independent cognitive analysis, group cognitive analysis, identify, interpret visual, auditory, and tactile information, recall information in a timely manner, incorporate and integrate new information, compare and contrast similar and dissimilar information, be able and willing to follow instructions, directions, and requests, identify and rank problems, independent generation of ideas, be able to formulate written and oral answers, questions, and integrate a large amount of information at one time. You also must be able to visualize spatial relationships, computational analysis, and receive and appropriately respond to constructive criticism from your peers and instructors alike. So the application requirements are located on our website at prcc.edu. Specifically the PTA program. You can also Google PRCC PTA program to access our website. So these are the specific application requirements. First, you must apply to Pearl River Community College. There is an application link in our website. You will be required to have official transcripts from your high school and every college that you've attended, no matter how long you've attended the college. We will also need you to upload your ACT scores. Once you have received your information to access River Guide by being accepted to Pearl River Community College, you will be able to apply for admission to the PTA program through dynamic forms via our website. Please make sure when you fill out this form, this online application, that your phone number and email address are always up to date. You will also be required to attend an information session or viewing the video on this website. Either is accepted. You'll need to upload a copy of your driver's license or identification. All of this is going to be due by April 1st of every year, regardless of the day that April 1st falls on. That is our hard deadline. Now, no prerequisite coursework is necessary to apply for our program, but it is highly encouraged and can help you with success if you do have dual enrollment or previous coursework in our academic curriculum. If you are a high school student and you have under 12 hours of any of our academic prerequisites, then you must have a 3.5 GPA or above to be considered for our program. You will also be required, once you're accepted into the program, to have a satisfactory background check and a drug screen in order to continue in the program. This will be completed at orientation once you are accepted into our program. So our PTA and curriculum requirements are also located on our website. And if you click on the link to that or go from our website and click on curriculum, you will see that in addition to our specific PTA courses, we also have academic co-requisites of college algebra or higher, English Comp 1 or higher, general psychology, speech, as well as humanities course, which can be a fine arts course in art appreciation, music appreciation, or theater appreciation, or another type of course in humanities such as world civilization. Also, you will need to take as academic co-requisites anatomy and physiology 1 and 2 with labs, and those can be taken prior to the program or during the first year of the PTA curriculum. So how do you calculate your application score? This information is located on the website, but just to give you a little bit of overview and tutorial on that, if you have more than 12 or more hours of our program core semester hours, so even if you have a bachelor's degree, if you don't have at least 12 hours of those academic courses listed as part of our program, then you would not be considered in this category. So these are people who have at least 12 of those courses that I just talked about previously. So this would be Bonnie. She is our example. And how to do your rank score is included on our website as well. But let's say Bonnie had an ACT of 26. She would get the full 21 points for the highest ACT score that we credit times 0.20, which will give her 4.2 points for her ACT. Let's say that Bonnie had the program core courses of at least 12 or more hours, so we take her overall college GPA, which she has a 3.7. So we say 18 points for the 3.7 on our calculation chart times 0.40, which is 40%, and that gives her 7.2 points. We then look at her core courses within our curriculum. So she has academic courses of 12 hours or more, and she has a 3.5, so we give her a core GPA of 16 points times 0.40 equals 6.4. All right. So we also take away 1 point for any repeated courses where the original grade was F or where the grade was taken with a resulting grade of F. So let's say Bonnie has 1 F, so we will take a -1 and put it into her rank score. We also we don't require observation hours, but they are highly recommended because you do get an extra point in your rank score for doing the observation hours, which can make a huge difference with a very close rank scores among applicants. So Bonnie did 18 hours of observation. It doesn't matter if Bonnie does 16 or 1600, it's only worth 1 point. But if Bonnie does less than 16, she does not get any points for this. So Bonnie has the 1.0. We are able to calculate her total score as the 4.2 plus 7.2 plus 6.4 plus 1.0 minus the 1 for the 1F, and that equals a 17.8. So all of this information is taken from the transcripts and from the ACT score and on the observation form that can be uploaded into the dynamic forms when you apply. And we put this into an Excel spreadsheet to come up with a rank score. So Bonnie's rank score is a 17.8 for her application rank score. Now we're going to do Clyde's score. So Clyde did not have at least 12 hours of program core semester hours or no college credit at all. He has an ACT of 24, so he will have 19 points for the 24 based on the chart times 0.40 equals 7.6. We take his high school GPA of 3.8, so that is 14 on the scale for high school students times 0.6 equals 8.4. So Clyde has 26 hours of observation, so we add 1 point for those 16 hours. He has no F's, so there is nothing subtracted from his score. So Clyde's total score would be 7.6 plus 8.4 plus 1.0 equals 17.0. So we take Bonnie and Clyde's scores of the 17.8 and 17.0, and then we put them all into a spreadsheet to do rank scores. We then typically interview the top 50 applicants that we have, and we will have a cutoff score determined by our community advisory board to take those top 50 scores. From there, we will conduct an in-person interview, and each applicant will be given a score based on the interview, which will be added into their application rank score and divided by 2 in order to give a final rank score. And then we accept 25 into the program, so the top 25 scores then will be given admission to the PTA program for that year. So once you finish the PTA program and also pass your board exam, there are a lot of areas that physical therapist assistants can now specialize: cardiovascular and pulmonary, acute care, geriatrics, neurology, orthopedics, pediatrics, sports physical therapy, and wound management are the 8 areas that PTAs can now specialize. This gives the therapist a greater depth of knowledge and skills related to a particular area of practice. You're not required to be certified, but this is something to help you also with marketability when you're looking for a job. So just some resources that are out there. You can go on to and look into the American Physical Therapy Association at www.apta.org. Also moveforwardpt.com. And APTA has a PT Careers Ask a Student that you can look at their frequently asked questions about PT and PTA. You can also look into the Commission on Accreditation in Physical Therapy Education, Federation State Boards of PT, and the Academic Council of the American Physical Therapy Association for more information. So there are a lot of things that we do as far as training our students once they are in the program. We do a lot of hands-on activities and learning how to do range of motion measurements and strength measurements and treatments with modalities and exercises so that you are ready when you go out into your clinical education and into your job setting to perform good patient care. So our students, again, are very active in the training process. So we don't do as much lecture as we do hands-on and lab skills and training activities. So if you have any questions, you'll want to contact L. Sylvester at prcc.edu for questions that aren't answered by looking at all of our website information. And that should help you with the process. You can contact us with those specific questions or call the number on the website if you need more information. We have provided as much information as possible on the website to hopefully answer those questions for you, so please check there first. Thank you so much, and we look forward to seeing you in our program soon.